So in this session, we're going to be looking at some of the models in formulating your research questions. So it's going to be a very compelling one. So remember to like, share, and subscribe. Let's go.
Yeah, what you need to understand is that when you have access to this video, you will have to have more clearer information, right, on how it's just technically easy for you to formulate your research once you have a model, and it's very important. So we'll be discussing with an outline to make it more clear. And first of all, we'll start by talking about the importance of research, importance of models in formulating a research question. If you realize that many a time when, particularly during your undergraduate days, when you were, maybe if you're in Africa or anywhere, right, when you were an undergraduate, most times it's just your supervisor asking you to do what they want. Maybe they might tell you, maybe work on prostate cancer, come up with a topic or come up with a title on prostate cancer. And it becomes a problem because you now begin to say, prostate cancer on what? Prostate cancer among who? Prostate cancer to who? When? Why? And those questions arise because of lack of a framework in formulating your research question. But it's very clear that if you use a clear-cut model, some of the models we're going to be explaining today, it makes formulating your research question very, 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 very easy. And it's just more like a snapshot. It goes straight to the point, and technically it makes your research very, very easy. So after talking about the importance of models in formulating research question, we also look at some of the various models of formulating research question. It doesn't matter whether you're using a qualitative research or quantitative, regardless of the nature of your research, right? We're going to be clear on which model is appropriate for which. That's what we'll discuss in choosing the right model. Then we'll leave you with some exercises that would make a lot of sense for you. So this is where the whole ball game starts. Very beautiful, or would I say a handsome dog currently projected on my screen. Models for research questions. Now, if you have a look at this image here, right, you get to understand that technically the reason why we use model is that models helps to create a clear, focused, relevant research question by providing a structured work. So just like I explained at the beginning, I made it very clear that if you want to start your research, it's very important for you to use a clear model to underpin your evidence. And that model makes it clear. It helps to improve the specificity of your research question. And the benefit is that it ensures that the question that you're looking at addresses the key components that you actually really need to have your effective research and make the research process more organized and systematic. So if you, on the basis of you conducting your systematic review, whether you're a beginner or regardless of the nature of your design, right, you need a model, and that model is going to be very essential all through your research, because you realize that the same model you use in formulating your research question is also going to guide your eligibility criteria. It will guide your search strategy. In short, it will guide the entire aspect of your research. And that is why it is very pertinent for you to understand the perfect framework that suits your research. So if you look at these images here, it's just very simple. We have models like the PECO, spiders, spies, and all that. So we're going to also explain how all these models relate, particularly when you're on the course or you're on track to performing your first systematic review. So this is actually a very fantastic image out there. Somebody's trying to fit in all the boxes into its appropriate model, and I believe this is a very compelling visual for your perusal. So straight to the point, before we start talking about our questions, what are some of the models we have in research, particularly in conducting our systematic reviews? So even if you're hearing about models for the very first time, what you need to understand is that the models for formulating your research question is not different from, it's not really different from what you've been doing, but the point is that the models is a very fundamental element that makes your question very direct. So we have different models, and these models are numerous frameworks that can actually be employed to develop any sort of research question, like be it for systematic reviews, scoping reviews, your primary research, randomized control trial, cohort studies. They have a model to fit in. And we've said a lot of things about models, so we need to now contextualize it. But then before then, we need to understand the different types. So we have what we call some of the known models. We have what we call the PICO framework. So the PICO framework is like what we call the population. So before you start your research, when you're designing the framework of your research, you always have a population of people in mind. Who do you want to investigate? Who are you looking at? Who are your target audience? Right? So that's your population. So sometimes it can also be used as problem. The P there can be used as problem or population. Now, let's say in terms of problem, we could say, okay, we're interested in pregnancy, right? As a maternal complication or as a maternal problem, or we're interested in type 2 diabetes. So depending on the context of your research question and how you intend to define your P. Now, we also have what we call the I in the PICO, the intervention. So it could explore what type of intervention are you addressing? Are you formulating a research question that is seeking or that is aimed at targeting a particular intervention? Meaning when you sat down on your couch or on your sofa and you're thinking about the title, you came up with a population group, let's say pediatrics, you're interested in, probably you're interested in immunization, maybe a certain type of vaccine, right, as an intervention. Then you're trying to compare it with another type of vaccine in your comparison, and the outcomes there might be maybe neonatal death or other neonatal complications. So in that way now, these are some of the elements that have shaped your thought process. And then it means that when you want to now formulate that question, you will now use a PICO framework to formulate it. I'm going to also demonstrate this. Also, in terms of our spider, the spider combinates of sample, phenomenon of interest, design, evaluation, and research type. So it's just similar, but there might be some components of your question that might not really sit into the PICO framework. Then it means that you have to use the spider framework to formulate your questions. We'll also demonstrate that. So your sample here could be your participants, maybe it could be older adults. The phenomenon of interest could be maybe usage of contraceptives. Your design here could be maybe qualitative designs like phenomenological studies and all that. Your evaluation can also be known as outcome. It could be, maybe you're interested in their experiences towards the usage of contraceptive among older adults. And your research type here is qualitative research. Now remember here, I meant qualitative research. Here can only be three things. It can either be qualitative, quantitative, or mixed method. Whereas here it could now be, when you look at the qualitative study design, it has a qualitative research, it has several types of design. It can be grounded theory, it can be phenomenological design, it can be case design, it can be narrative design, and all that. If it is a quantitative research type, it can be cross-sectional, it can be randomized control trial, it can be cohort, it can be, in short, it could be a whole lot of things, right? So that is for the spider, but we'll come to that. Now, we also have another framework So if you're listening out there on our podcast, right, we also have another framework that we call the PEO framework. So the PEO framework, it can be used for any type of research question. So it just narrows it down: population, exposure, outcome. We have what we call the PIO here. You remove the comparison. What? Population, intervention, outcome. We have the PCC as another different type of model, which is identified as the participants, concept, and context. And it's used mostly for scoping reviews. And we have what we call the SPICE, which is the settings, population, intervention, context, and evaluation. We just have a lot of them, right? This is just a tip of the iceberg. So here can also be called certain perspective, just depending on how you contextualize it in framing your research question. Now moving forward in a fantastic mode, now we will have a clear look. Now we have some common used models when we are writing our research. And the PICO model is one of the popular frameworks that we use in formulating our research. Now you have to understand that the PICO model is used mostly for quantitative research, like clinical trials. Maybe sometimes you can use it for cohort studies and more like randomized control trials. That is when you use what? The PICO model. Depending the PICO model. Now, when we say we use the PICO model or the PICO framework for formulating our research question, what we are trying to say is that the PICO model provides suitability for your randomized control trial or for your experimental design-based study. So let's assume I just sat down on a table and I have something in mind. I want to start my research because this is widely the basis of it. So I'm going to open a sheet here. I'm going to call this the rough sheet. Right? So I just sat down on the table and I just have nothing in mind. So, for example, I want to do a research on, for example, malaria. I just have malaria in mind. And now, where does model come in? Now, I can use using with this term in my mind, right? I can formulate my research question with several models. So I could say population, because I have the PICO framework now in mind, right? So I could say my population here could be what? Adult patients in hospitals, right? Remember, I'm trying to come up with my what? Topic, because when we talk about formulating your research question, it's not different from your topic. When you're asked the question, what is your research question for your PhD? It still means what is your topic. It's not different from that. Or what is your main objective? Or what's your thesis title? So they can be used they can be interwoven, right? But it's just something. You can also be asked, what is your hypothesis? What was your hypothesis during your PhD? How did you formulate your hypothesis? So they are all the same thing, but depending on the context where they are being used. Unless maybe when you now come into the work now, you formulated your question and you now want to clearly maybe test some certain parameters. You can also say, oh, I've got this null hypothesis, I've got this other alternative hypothesis, I've got this other hypothesis and all that. But the point we are trying to make is that when you're if you're being asked to formulate a title, like in this exercise, if I'm giving you a title, maybe I give you a concept, let's say cervical cancer, and I ask you to go and formulate a research question using this broad term. So what I mean is that you can actually formulate 21,000 topics or research question using what? All these what? Framework. Right? So, but then I'm going to come back to that. So let's get back to our example here. So I'm going to make it bold. Now, So now we have malaria as a broad term, and we want to formulate our research question. So what does it imply? What it implies now is that I have a model in mind, PICO. So I said my population, maybe what I want to focus on now is adult patients. It could also be that I want to focus on maybe HIV positive women aged 20 and above. Or I want to focus on teenagers in SSA. By SSA, I mean Sub-Saharan Africa. Right? So good. Now my intervention. Now I could focus on the new one, malaria vaccine. Right? So for comparison, so it could be anything. I could focus on placebo or other interventions aside from malaria. So my outcomes in mind, what I was interested in is I'm interested in all-time mortality. Maybe I'm interested in complications. I'm interested in death. Maybe also quality of life as a result of. So I could now come here clearly to say that I have formulated my research question, and now my research question could be how effective is malaria vaccine compared to other interventions in reducing. I could just group all this, everything here. Let me say, for example, now let me just group everything in our outcome as mobility. This is an example, just an example. Reducing morbidity among teenagers in Sub-Saharan. Now this is what my research question. Now remember, it is not different for if you want to present this as your topic, it's still the same thing. You could say effectiveness of malaria vaccine compared to other. So I'm going to copy this. All right, click. I'll copy. All right. So this is what we mean. So this is an example of a clearly formulated research question. So the topic is effectiveness of malaria vaccine compared to other interventions in reducing mobility among teenagers in Sub-Saharan Africa. It's just the same thing with this. So it means that I just demonstrated how you can formulate a research question using the PICO framework. So back to the slide. So here we say, who is the study about? Teenagers. What is being done? Malaria vaccine. What is the alternative? Other intervention. What is being measured? Outcome. Lots of them there. So here now we have an example. In adults with hypertension, maybe, right? Does regular aerobic exercise compared to no exercise reduce blood pressure. So that is just example. So here, now, if you want to set it properly now as a topic, because somebody might be asking, "Oh, does it mean that this the question and the topic they are just the same thing? It's just all about how you set it properly." Right? So this could be a systematic review of, maybe you could say, effectiveness of regular or efficacy or impact of regular aerobic, or maybe you remove the effectiveness and impact, say regular aerobic exercise in reducing blood pressure among adults with hypertension. Sometimes you might not necessarily need to mention the comparator in the topic and the outcome as well, right? So it doesn't mean that they must all reflect in the title. But what point am I trying to make is that when you want to formulate your research question, you need to sit down and think of a model. That is the proper way to start before starting your topic, because at the end of this lecture, everybody must have a warning title. So whether you're listening to me or you're listening to me on our podcast, it means you're listening to me in the future. You need to pen down a broad area, maybe anything that you're interested in. It could be AI and anything, whatever. Just pen it down and come up with a title, and use your, just follow the model and you come up with the proper title. So moving ahead, we have the PCC model. Now the PCC model is a model that is used widely for scoping reviews, right? We use the PCC model widely for what? Scoping reviews. So it's just the same thing. I'm going to also show an example with that. It's useful for scoping reviews and identify the key aspects of the topic. So population is who is involved. Concept is what is the main idea and focus. Context sometimes can be used in what setting or what's the situation. So now we'll have another example of that. So I'm going to come down. So let's assume I'm interested in, for example, domestic violence, right? And now, I want to do a scoping review, and I'm thinking of how to focus on my title. Remember, you always have something that you have of interest before you now begin to navigate and direct it. So maybe moving ahead, I could now say, okay, let's look at the population to be, for example, marriage purpose, right? So concept, experiences, or rather, let me put it as work violence. Then put it here as doctors, experiences of what? Work. So that is the concept, right? Now, it can be used interchangeably, right? Experiences can be my concept. Experiences, then the context will now be what the situation now is workplace violence. But then if I'm trying to now force it in, maybe trying to make an adjustment in my title, because experiences of what? Work violence as my concept, in my context in what? Sub-Saharan. So this is the setting. Remember, we identified our context as what? Setting or situation. But then we can actually move in or situation if to suit our concept with our what? With experience. So this comes as what? This topic comes this way. What is the experience? Okay, you can call it anything. Maybe let's use Nigeria. Okay, no, let's leave it as. You know, a scoping review is usually very broad. You're just trying to map literature. So the best framework model for formulating research question in a scoping review is the PCC what? framework. So this becomes your topic, but if it is your question, if you want to put your topic, it could be a scoping review. You can prefix or suffix the word what a scoping review. It can come as your prefix or as the suffix. So this is what I mean by that. The scoping review on experiences of, right? Or experiences of the same as a suffix. So that is it. So that way you are getting what started. Remember that it is very, very paramount for you to use a clear model in formulating your research question, regardless of your research. So now we move to the next one, which is the PEO framework. Now the PEO framework is another popular framework that we usually use. Stands for population. Who are some of the people involved? Your exposure and the outcome, right? So it's used mostly for it can also be used for quantitative studies sometimes, right? So if you look at this woman here with the baby, it makes a lot of sense. Exposure, that's the children, population, exposure, outcome, right? So who are the people involved? What is the exposure experience? What is the outcome result? So here's an example. What are the experiences? Experience now becomes an outcome of new mothers, population, who have undergone home birth exposure, right? So that is it. So we can also give an example of that as well. So I'm going to come down here. Maybe I have something in mind like cancer, and the framework in mind is the PEO, right? So I could say, what am I interested in? I'm interested in late stage diagnosed women. Right? So I could now put in late staged cancer diagnosed women. Or maybe let me add breast. Okay, then I will take out late stage, right? So we'll make the question more easier. So breast cancer diagnosed women in the USA, and our exposure, that's going to be that's what I have in mind after thinking of everything that I want to do on breast cancer. Because if I want to do it, because it's going to be so broad. Remember, we have always explained why you need to be very specific. One of the attributes you need in refining your research question, and we being specific in terms of even the type of morbidity or disease is also very imperative, and that is why we have put this. And then you have the exposure, which is going to be, maybe I could choose experiences, some of the experiences, or maybe I could put maternal experiences, right? Then in the outcomes, maybe I could put anything. I could also put or I could put experiences in my outcome by trying to do that. Then exposure is chemotherapy. So now this is a very, so I could now come up with what are the maternal experiences of right? Good. So what are now the question is now clear. My population is breast cancer diagnosed women in USA. Exposure is chemotherapy, what they're exposed to, chemotherapy treatment. My outcome is maternal experience. So I'm now asking, what are the maternal experiences of breast cancer diagnosed women in the USA in their use of in the use of chemotherapy treatment. So this is a qualitative study. So I could now put it this way: if my title for my systematic review, I could just take this, right? Maybe prefix it with a qualitative systematic review on the maternal experience, and this is it. On the maternal experiences of breast cancer diagnosed women in the USA in their use of chemotherapy treatment. So, and that is my question, right? Good. So we move on. So we also have another framework that is also widely used, which we call it the spider model, right? It's used mostly for what? Qualitative studies and mixed method research to help formulate your research question. Particularly, it helps in identifying key components. So one of the elements of the spider framework is sample, which is still the same question: who is being studied? The PI is phenomenon of interest, what is being studied or what's focused on. Then when you look at the design, it could be how is the study designed or how is it structured. And the evaluation is what are the measures and outcomes. So evaluation here is literally the same thing as what your outcome in your spider model. And in terms of your research type, it is what type of research is being conducted. Is it qualitative? Is it mixed method or quantitative? Depending on the context where it is being used, right? So here is a clear example here. We have what are the experiences, which is evaluation of frontline healthcare workers. Sample dealing with patient care during the COVID-19 pandemic in a qualitative research study. So remember that in your title, your research type might not necessarily be in your title. But most times we've had some publications where we submit an article to a journal, particularly systematic review, like one of our recent studies that will soon be published on BMC, very big journal. Right now, when we submitted the manuscript, one of the revisions that was asked by the reviewers was that we should make our research type clear in the title, which we had to do, obviously. And that is just it. That is just how it works. So what point am I trying to make? What I'm trying to say is that you can have your research type reflecting on your title, and you might not have it. But the idea is that before you start your systematic review, you need to have a clear model that you will be working with. So I'm still going to have an example of this as well, just like I did for others. I would go down here. So what can I have in mind? I could literally have anything in mind for me to formulate a research question using the spider framework. So I could have, let's go, for example, I could use immunization, right? So let's say I'm coming from an immunological background, or as a public health practitioner, I'm interested in immunization, vaccination. That's one of my core areas for research. And I want to formulate my title. So what am I going to do? What I'm going to do, it's not different from what I've done from others. And I want to do a qualitative study. And I have the spider framework in mind. So what am I going to do? So I need to set out my sample, right? So my sample. Remember here, this can also be used as setting sometimes. And that is why if you realize, these other research questions, I usually make sure that some of these, any frame model that doesn't capture the population or the location, you try to capture it in the what? In the population. You try to capture it in the what? In the population. For example, what am I trying to say if you're listening to me from the podcast? Like, for example, I have imputed the population when I was trying to formulate a research question using the PECO framework, right? Now, I have said breast cancer diagnosed women. I didn't end it there. I added what? The USA. Similar to my scoping review here. Okay, although in scoping review, you have area for context, right? But if it doesn't work there, you can put it in your what? In your population, doctors in sub-Saharan Africa. And the same in my PICO framework, when in my population, I have matched the what? The setting, right? I wouldn't put it here, malaria vaccine in sub-Saharan Africa. Rather, wouldn't I put it here? I won't put it here either in my outcome. I won't put it in my comparison. I won't put it in my intervention. It's best fitted in my what? Population. And this is one important thing you need to know. When you're formulating your research question, you need to have a particular location in mind. That makes your question what? More specific and more detailed. So now, what am I going to do? What I'm going to do now is going to take out the setting here. I'm trying to formulate my research question using the spider framework. So I'm going to say the sample of interest here is going to be, I'm going to say mothers of under 5 children in Nigeria, right? So my phenomenon of interest is, I'm interested in what? Compliance, right? I'm interested in what? Immunization compliance. Remember, one tricky thing you need to understand when you're using the spider framework is not conflicting it with your what? With your evaluation. So I'm interested in immunization. That is what I'm interested in, right? That is what I'm studying. I'm interested in what? Immunization. That was what brought me here. Please note that. Now, in my design, I'm interested in what? Studies that used maybe qualitative. That's, I'm interested in grounded theory, interested in case studies, interested in, maybe I want to make it a mixed research, right? So I'm going to bring in cross-sectional studies. So this will be my what, the type of designs that I'm going to look out for, right, when conducting it. But alternatively, or I can actually put it in this way, studies that use an interview. Remember, this is if we're looking at it from the angle of the secondary research. But if we're using the spider framework to formulate the normal primary research, we'll just put what? Interview, or we'll just put one primary research design that we want to use, which can be grounded theory. So we need to put studies because it's a primary research. What do I mean by primary research? The primary research is the type of research that is mostly conducted by the researcher has a direct access to the what? Participants, right? Whereas in the secondary research, the researcher doesn't really have access to the what? Participant. He only has access to the records, right? So if you're doing a retrospective study, it might not really be what? It depending on the position, right? But in this case, we're looking at the secondary research from a review, systematic review standpoint, which is the basis of everything we are talking about. So you don't have access to the participants, you only have access to already published studies, right? So here now you'll be looking at grounded theory, studies that used what? Grounded theory, or any form of qualitative design, primary design, or we say case studies focus group discussion. Now, in terms of our evaluation, remember, you don't need to confuse your evaluation with your phenomenon of interest. Now, what are we evaluating now? We're interested in what? Compliance, right? In their compliance towards immunization. So what could be our research type? Our research type could be what? Our research type now could be what? Maybe a mixed method research. So it means that if this is a systematic review, we'll be looking at both quantitative and qualitative studies in our included studies. But if it's going to be a qualitative, then we'll look at what? Qualitative research. Now, remember that the idea behind using a model to formulate your research question is that you just have a concept here and you want to come up in details with a specific plan on how you intend to execute your research. That is just the idea. So that is it. Now, in that case, your question will now be so simple. The research question now become what is the immunization compliance level? We'll say compliance level here because this seems quantitative, or we can say what is the immunization compliance of mothers under 5 children in Nigeria. So this is a simple question, right? This doesn't necessarily need to be in the question, as well as what this. So if you want to put it as a topic, we could say exploring immunization, or exploring, or we can say this is as compliance. Leave it this way. Exploring immunization compliance among. So this becomes the running title. Then you can decide to prefix or suffix it with what? A systematic review. So that way you've been able to do what? Come up with your what? Right. So what are we saying in a nutshell? There are a lot of approaches, there are a lot of models out there that helps you in formulating your research question. It's just very detailed. There are a whole lot of them. So what are other models that we might not have really looked at, which are very important? We have the PECO framework, where we look at the population, exposure, comparison, and outcome. Also, we have the SPICE. We look at the setting, like I said, perspective, intervention, comparison, and evaluation. We have the PIO, which is more like the simplified version of the PICO framework, right? Which is used for broader research topics. And we also have another example there, which is where we used it for the PIO. Does reducing sugar intake improve health outcomes in children? So children in low and middle income countries, right? And all that. So you have to make your own question specific. So we're coming here now to choosing the right model, right? So how do you, when do you need to know what model is appropriate, right? When should you know the model that is appropriate for you? And it's just very simple. A problem that most PhD students battle with, and master students as well, right? Which is, you choose a model that fits the type of research you want to do. So for example, if you're conducting a clinical study, just like I said, PICO model is very, very essential. Anytime you're doing a meta-analysis or you want to do a systematic review that requires comparison, trying to determine the effectiveness of any therapy, a PICO model is very appropriate, because for you to determine the effectiveness of any therapy based on epidemiological evidence, randomized control trials are pertinent, right? So that means you just have to use the what? You have to use the right model, which is the what? A PICO model that will accommodate all the domains of what you want to talk about. That is just the major idea behind the PICO model. The PICO model will accommodate all the domains that you really have in mind. Now it's going to help you to frame your question and make it very precise using the PICO model. It will help you frame your question and make it what? Very, very precise. That's all about treatment effectiveness. So for qualitative studies, what's best? We have PEO, just like I said, population exposure outcome, very suitable. We also have spider. We can use spider in that sense, depending on your research. If you're listening to this podcast or you're watching this video and you're trying to conduct a research that is coming from the social aspect, right? Maybe you're like, we looked at an example here of domestic violence or gender-based violence or whatever, workplace violence. You need a framework that is suitable, and the spider framework is very important. It's advisable. So we have the spice as well. So the elements of this framework are very, very self-explanatory. They make it very easy for you. They help you in guiding you, in shaping your thoughts, right? In identifying your research questions. So in our future sessions, right, outside that, when we'll talk about gap identification, you also realize that your chosen model can also help you identify gaps in literature on areas where research has not really been conducted, so that you can know how to shape your question, because that will be another information to battle with. Because once you have not formulated your topic, you wouldn't want to have a title or a research question that is already chosen. You would like to want something new, and that is where your research gap comes into play, and you still need a model to use in formulating your research gap. So gradually we are coming to the end. So we have a couple of practice exercises here. You have to apply the PICO framework, easy to create a research question out of effect of diet or heart attack. Just make it very complex. You can also work on 10 more titles using the PICO model. And this is also another exercise that I'm giving out there, understanding the experiences of patients who use telemedicine for mental health consultation. So try and attempt deciding which model will be appropriate for it. So it could be spider, spice, PEO. Just try and identify which is pertinent. And we have the third one exercise, which is converting a broad topic to a specific question. So this is something very broad. You can also attempt this and get it done. So in our next section, we'll be looking at developing research rationale and answerable research questions. And also here we'll also touch highlights on gap identification. So before we call it a day, I would just like to have a rundown of literally everything that I've talked about today. So I just introduced the outline when I started this session, that we'll talk about some of the importance of using models in formulating your research question, right? And we made it very clear that we've got various models for formulating our research questions, and it's very imperative for us to choose the right models. Yeah, so we started by explaining that models, research question and models helps us to create a clear and focused and a very relevant research question by structuring and providing a very great framework for us. And some of the benefits is that it helps us it makes the key components of our research questions very clear and makes it very systematic. So we looked at different models such as the PECO framework, which stands for population, intervention, comparison, and outcome. We looked at the SPIDER framework, stands for sample, phenomenon of interest, design, evaluation, and research type. And we also examined the PEO, which is the population, exposure, outcome. We also made it clear that we have other frameworks like the PIO model, the PCC, SPICE, PECO, a lot of them. So for the PICO framework, we started and we had a demonstration where we showed clearly how we can formulate a research question just having only malaria in mind, right? Just having malaria in mind, we're able to come up with a framework using population, the domain. We have an intervention, with our comparison, and our outcome, right? So properly placed The PICO framework helped us in shaping our thoughts, and we're able to come up with a question like, how effective is malaria vaccine compared to other interventions in reducing morbidity among teenagers in Africa, right? Good. So we also made it clear that we can also use it to formulate our title. Then we moved on from the PICO to the PCC framework, where we say that the PCC framework is widely used for scoping reviews, right? So PCC stands for population, concept, and context. So by population, we mean who is involved. By concept, we mean what is the main idea of focus. And the context is what is the setting or situation. So we also showed an example of how we used our PCC framework when we came up with something in mind, workplace violence, right? We can call it workplace violence. And we said that let's assume that our population or the patients, remember this can be population of patients, right? So it's doctors or nurses or whatever. Then it means that our concept is experiences of workplace violence, and our context is what? Setting. We're looking at it from the what? Setting point of view. So our question now becomes, what is the experiences of doctors towards workplace violence in sub-Saharan Africa, which our topic is scoping review on experiences of doctors towards workplace violence in sub-Saharan Africa. Now we said that you can prefix or suffix your intended review in your title when you formulated it, right? Good. And we also talked about the PEO, where we used breast cancer diagnosed among women in USA, exposure chemotherapy treatment, outcome maternal experiences, and we're able to come up with our research question, which is what are the maternal experiences of breast cancer diagnosed women in the USA in their use of chemotherapy. So we also said same thing. You can prefix your title, or you can do what? You can suffix it. That's your research title. Now, the same thing applies for the SPIDER framework also, where we had immunization in mind, and we were able to come up with a sample, or which sample is also known as what? Your population in the S of the SPIDER. The PH means the phenomenon of interest, which is immunization. Remember, our sample is mothers of under 5 children in Nigeria. Then the design could be some of the various study designs that you might be looking out for, because when you're starting your research, your systematic review, you have some designs that you're anticipating that will be included in your study. So that is where your design comes into play. And in terms of evaluation could also be known as what? The outcomes. What are the outcomes that you're intending to review? Then we're looking at compliance, and the research type is qualitative. It could also be mixed method, it could be quantitative or whatever. And we're able to come up with our question, which is what is the immunization compliance of mothers of under 5 children in Nigeria, and as well as our what? Title, which is exploring immunization compliance among mothers of under 5 children in Nigeria. Then we didn't end it there, because we talked about, then we now say, when should you choose? What about other models? We've got the PECO, SPICE, PIO models, which are other models that can also be used, right? And I was like, when should you know when to choose the right model? Now, you need to know when to choose the right model when you want to understand the type of question you're seeking to address. So let's assume you're looking at a clinical question, or you're trying to do a research that is going to compare 2 drugs, right? So it means that in that situation, a PICO framework is going to be likely suitable for you. Or you're trying to do a primary research that you're trying to do a systematic review where you want to explore information or experiences, then SPIDER or PEO will be suitable for you. It's just all about your justification, justifying that model and using it appropriately, right? And also your focus is also what you need to consider, right? So if you're interested in the experiences of a specific group, you need to use the SPIDER model. So we give an example as well for that. So here are our exercises. So I just want to thank you people very much for staying up until this time, listening to me and paying attention.